Hello everyone, this is Avibsha Day and once again welcome back to The Uncut, where we speak anything and everything about women's health. So today we will be talking about PCOD and I think this is 2023 and hormonal issues are the major problems among young girls, especially in India. And we should talk about it without any fear, without any embarrassment or awkwardness. This issue need to be spoken about. I am a teacher, lecturer, whatever you say, and it's my foremost duty to spread correct education, more specifically correct knowledge. So let's get started. Almost 1 in 10 women is suffering from PCOD these days. So it's a new gynecological epidemic. September is designated to be the PCOD awareness month. So I'm starting a series of PCOD because I really think that PCOD is a subject which we cannot cover in one series or one video. We really need to talk a length about it. PCO, PCOD or PCOS are all one or the same thing. PCO is polycystic ovary, PCOD is polycystic ovarian disease, PCOS is polycystic ovarian syndrome. So when probably the disease is just limited to the ovary, we call it as a PCO. But when it starts showing its effect on other parts of the body by maybe hypertension or high blood sugar or obesity and other multiple problems in the body, then we call it as a PCOS. 60% of the patient actually go undiagnosed. That means the patients, the women, they don't even know that they have PCOD. 50% of the women, they are at high risk of prolonged diabetes or type 2 diabetes after 40 years of their age. PCOD patient also have a risk of getting endometrial cancer. All many of you, or it's not necessary that you are in a medical background or not, or from other background, but all the person, be it a woman, be it a man, be it anyone, you should know the basic thing. This endometrial lining or endometrial cancer or endometrium, okay, the endometrium is nothing but a inner lining of our uterus, okay. So our uterus, okay, this is a uterus, it has 3 layers. The first one is a perimetrium, the outer part, the myometrium, the middle one, and the endometrium, okay, the inner part. So what is this endometrium or endometrial lining? Suppose a person or a woman, in a women's body, the fertilization occurs, that is the meeting of the sperm and the ovum. So when the sperm and ovum, they meet to each other and fertilization occurred, that time what will happen? It will come to the uterus and the fertilization will continue. But what happens if there is no fertilization? What happens at that time? Egg, okay, that comes, or it forms a blood lining, okay, it forms a blood lining in the endometrial layer. In the endometrial layer, that blood lining occurs, and if there is no fertilization, that blood lining, it sheeds off or it passes out or expels out in the form of blood, okay, that we call as a monthly period or menstruation. Okay, this is the basic thing. So in that endometrium, that is what I say, that the person is at high risk of endometrial cancer. So there will be cancer in the endometrium layer. Okay, it's a very simple thing. Now, these are very alarming statistics. We really need to understand this and treat the disease in a proper way. So let's first talk about the symptoms. Now, many of you already know about them. Number 1 symptom is problem in periods. Maybe it is delayed, maybe it is irregular, sometimes it is very scanty, sometimes it is earlier or prolonged. Second symptom is the person is gaining too much of weight and she finds it really difficult to lose the weight. Number third is women have sign of male pattern hormone. That means they have excess of acne, then there will be scalp hair loss, then there will be too much of body hair, especially in the chin or in the upper lips. The fourth one is one of the common symptom, that is infertility. That means a patient, they come up with a problem, with a complaint that they cannot conceive easily. Number fifth, quality of sleep becomes bad. That means there is a disturbance in sleep at night. They snore a lot, they suddenly wake up at night while sleeping. And when they wake up in the morning, they don't feel fresh. They have lot of mood changes, anxiety, depression, exhaustion, and many more. Host of problem actually develop because of PCOD. So now, how do we diagnose the PCOD? Number one component is irregular period. Number two is clinical and biochemical evidence of male pattern hormone, that is acne, scalp hair loss, or body hair, etc. The third point is USG, ultrasonography test. If the radiologist says that the volume of ovary is more than 10 ml and if it is showing more than 20 follicle in each ovary, then yes, it is also a point to be diagnosed PCOD. Now let's talk about what causes PCOD, how it is caused. The first causes, some people say that it is genetic, that means it came from the previous generation. The second reason is a bad diet. No, bad is a very strong word. I would rather say a poor lifestyle, such as having poor diet, maintaining poor diet, or very wrong diet, or poor sleeping pattern. So overall, it is a poor lifestyle. The basic culprit of all this thing is insulin resistance. Now, what is this insulin? Insulin is a hormone which is secreted by pancreas in our body. The main purpose of insulin is to pick up the glucose from the blood and use it as an energy to the various parts of our body. Now what happens? In this PCOD patient, the insulin is not able to do their job. That means the cells are not able to pick up glucose from the blood. And the body, as a compensation, produce more insulin, leading to high insulin level in the body. And this high insulin level in turn stimulates the ovary to become more bulkier and to produce abnormal hormones in the ovary, which are mostly the male pattern hormone. There is also a latest research which says that PCOD is a cause of chronic low-grade inflammation in the body. Now, inflammation is actually a stress response in the body. Suppose, for example, whenever you get hurt or whenever you are injured or whenever you are in problem, the body is into the inflammation mode. Low grade inflammation could be because of chronic stress. It could be physical stress or mental stress, or because of lack of physical activities or wrong diet, or sometimes because of disturbance in sleep. Another important reason of PCOD is chemical pollutants in your body. That is the use of plastic, the use of aluminium foil for packing up the foods, the use of room freshener, the use of talcum powder. So all these have chemicals which plays havocly with the hormone. So lastly, I want all of you to think on some point till we meet in the next video. It's a new disease. Your mom, your grandmom do not have PCOD. In fact, women from lower socioeconomic strata or rural background, they still do not have PCOD. Think why? What is it? So we will address all these details in coming videos. In the next video, we will be talking about role of diet in the development of PCOD. So till then, stay safe, stay healthy, and most importantly, look after yourself. And please do like, share and subscribe to my channel, and I'll see you very soon.